Welcome, everyone. I'm Luke Gilgan. As we gather today to mark a special milestone at St. Michael's Hospital, we acknowledge this land, the people, and all other beings, animate and inanimate, today, as well as the ancestors. This area has been a place of communities coming together for well over 15,000 years. This land has been the territory of the Huron-Wendat and Petun nations, the Seneca, and most recently, the Mississaugas of the Credit First Nation. The territory was the subject of the Dish with One Spoon Wampum Belt Covenant, an agreement between the Iroquois Confederacy and the Confederacy of the Ojibwe and allied nations to peaceably share and care for the resources around the Great Lakes. Today, the meeting place of Toronto is still the home to many Indigenous people from across Turtle Island, and we are grateful to have the opportunity to work in community. We are also mindful of broken covenants and the need to strive to make right with all our relations, sharing stories and telling the truth of this place. Miigwech, Niue, thank you.
Good morning, everyone. My name is Anoa Kwarku. I came to Canada as an international student in 2004. It wasn't until 5 years later, when I had a healthcare issue, that I realized I had absolutely no idea how to navigate the Canadian healthcare system. I didn't have a family doctor, I had no idea where to go, and I didn't feel sick enough to go to the emergency room. So I went to a walk-in clinic. I waited 3 hours in a cramped, fluorescent lit waiting room, and then I finally went into a tiny office, and I was out in less than 5 minutes. And then I ended up in the ER a few days later, where I waited for more than 5 hours, and when I left, I felt tired, I felt frustrated, and I was at a loss about what to do next. And then something happened. A friend of mine connected me to a family doctor who showed me what a positive healthcare experience could look like. For the first time since I came to Canada, I felt like someone on my healthcare journey had taken the time to listen and to care. I felt seen, I felt heard, and I felt believed. And I felt lucky, which shouldn't be the case, because as a racialized person, as an immigrant, and as a woman, I'm well aware that there are too many people like me who can't count on luck, who are stuck navigating a complex, overwhelming system, who have to tell stories over and over again, whose healthcare providers only treat the issues they see and not the ones that they can't, like barriers to accessing care and the social determinants of health. We all deserve a doctor like mine, who hears us, who involves us in our decisions, and these decisions really do affect our health, and who advocate to help us get the care that we need. She was there for me when I got a traumatic brain injury that was missed in the ER after a car accident. She was there for me when a medication I was on had rare side effects. And she was there for me when I needed a dermatologist who could diagnose skin conditions on dark skin. And I would rave about her to my mom. I would always talk about the experience of being a patient. And she would always say that it was just as important as treating the illness. My mother was a psychologist in one of Uganda's first integrated health teams, and they focused exclusively on holistic health. And she was a huge proponent of a great patient experience. She'd started mapping out how it could improve health outcomes, and she was planning to do this for her PhD. And I remember being with her as she battled cancer on the other side of the world, and she hated the hospital environment as a patient. She was often frustrated, and we would talk about the fact that the psychology of being treated as a sick person rather than as a person who happened to be dealing with an illness was a real problem. And that's when I realized it wasn't just a Canadian issue. It was a global one. And as a design thinker, I started to think about, why is there so little focus on the experience of care, the human aspect of it, and what it meant for patients and for healthcare workers who are already dealing with so much. The reality is, I am standing here today because of the empathy I was shown. Everyone deserves to feel confident in the healthcare they receive, no matter who they are or what corner of the world they come from. We should feel seen, we should feel empowered, we should feel accepted, and we should feel connected. And so when I learned about what St. Michael's is doing, this bold endeavor that you're going to hear more about this morning, it struck me. This is exactly what we need. This is exactly what is missing for so many people. Thank you.
Thank you, Anoa. That was incredibly powerful. It's stories like yours that have galvanized St. Michael's into action. In fact, it's the reason we're standing here today. Welcome, everyone. I'm Lily Litwin, president of St. Michael's Foundation. We are so happy to be with you this morning in person and online. This is a big day for St. Michael's and Providence Healthcare, and a very big day for Canadians. We're not here to announce a program or an initiative. We're here to launch a movement in Ontario, in Canada, and we expect around the world. What we're announcing today is nothing short of monumental. And it's the kind of bold and audacious thinking that transpires when the best minds in medicine, the most relentless health teams, the most visionary donors and volunteers, and countless Canadians come together to make change possible. We all have a stake in this. But before we tell you what we're doing and how we're doing it, we'd like to explain why we're doing it. For that, I'm pleased to turn it over to Dr. Najma Ahmed, Surgeon-in-Chief at St. Michael's Hospital.
Thank you, Lily, and hello, everyone. Healthcare leaders everywhere, and I mean globally, know all too well that there are parts of the day-to-day experience that patients don't like and things they want to see more of. So who better to give us their feelings, perceptions, and opinions about the patient care experience than Canadians themselves? It's one thing to recognize that patients want a better experience, but meeting that need in a field as vast and complex as healthcare requires that you dig deep. We know you have to know what people want, what people like about their experience. You have to know how many of them like that thing a lot, or maybe just a little. You have to know what people don't like, how many of them really don't like it, how many just don't like it much. And it's very important, and very importantly, you have to know who the people are who like something or who don't like it. Is there a pattern there, and does it matter? In the summer of 2021, Leger Canada surveyed nearly 2,000 Canadian adults to get a better picture of their healthcare experience, and they dove deep into particular populations, including Indigenous peoples, racialized peoples, gender-diverse Canadians, Canadians living with disabilities, and those living with substance use disorders. Because we also wanted to know, how do those experiencing marginalization in our communities feel about their healthcare experiences? By the way, it's important to note that not a single question was asked about any specific hospital or healthcare organization. That wasn't the purpose of this survey. So let me throw some numbers at you, and I'll try to throw not too many numbers, and I'll try to keep it all in context. But the movement that we are launching here today is informed by these numbers. First, the good news. There is good news. 67% of Canadians are satisfied with the quality of the care that they receive. That's a real testament to our healthcare workers, who I can say with conviction are some of the best in the world in their skill and their relentless commitment to our patients. And I suppose that that is really what makes the less good news so significant. Because what we know is that in a country where 76% of people are satisfied technically with the quality of their care, only 40% feel safe when receiving that care. Only 41% of our patients feel comfortable, only 28% feel accepted, 23% feel in control, 15% feel connected, and only 5% of our patients feel empowered. Think about that one. Just 5% of our patients in Canada feel empowered when receiving their care. And when we asked people across the country to tell us what they feel is the worst thing about their care experience, the vast majority said wait times. The next thing I'm going to tell you is likely not going to surprise anyone in this audience, and that is that for Canadians who are marginalized, these numbers are far, far worse. Almost across the board, even fewer people who experience disadvantage feel safe, comfortable, accepted, in control, connected, or empowered. And only a fraction say they feel that hospitals provide a welcoming and healing environment. Okay, I'm mindful of my promise not to throw too many numbers out there. An overview of the poll that we conducted is in your chair and in your inbox, and I urge you to take a closer look because there's a lot to ponder. But I want to shift from what Canadians don't like about their healthcare experience to what they want. First and foremost, they want change. Nearly 70% say the Canadian healthcare system needs an overhaul. For respondents with disability, members of the LGBTQ2+ community, that number is even higher. And how do they say they want it overhauled? Well, safe to say that all the things and all the concerns that I have just listed they want dealt with. But they got even more specific. Canadians want timely access to care, particularly timely access to specialists and in the emergency room. They want to be treated with dignity and respect. They want to be involved in decisions about their own care. They want to be spoken to in plain language, and they want to be heard. In a world of instant access to information, they want all their healthcare providers to have access to their medical records so they don't have to retell and repeat their stories over and over again. The findings I've laid out just now, and so many more that I haven't, all point to a healthcare system that delivers great care, but not a great care experience. And in this day and age, that simply is not good enough. Thank you.
Thank you, Dr. Ahmed. Those results are really telling. The good news is we're responding. And for the past 2 years, Dr. Tim Rutledge, President and CEO of Unity Health Toronto, has taken the lead on propelling the ideas, establishing the leadership, and putting in place the infrastructure to launch the biggest, boldest program we've ever undertaken. So without further ado, Tim, tell us about it.
Thank you, Lily. And hello to everyone who is joining us today in person, everyone who is watching us online, and everyone gathered at our sister hospital, Providence Healthcare. Many thanks to all of you for joining us for this very special event. So what is human care? Human care is a response to a demand. It's a solution to a problem. It's an acknowledgement that with the purest of intentions, we have all been so focused on providing the best medicine that perhaps we've lost sight of how patients feel about their experience of receiving it. And what they want when it comes to shaping the quality of their healthcare experience is very, very important. This isn't a St. Michael's Hospital problem. It isn't a provincial or a national problem. All around the world, healthcare organizations are confronted with the same challenge. How do we deliver the care experience patients want and deserve? It's no wonder, really. Globally, there are no standards or benchmarks for what constitutes an ideal patient experience, nor is there a universally accepted definition for it. And while there has been a lot of thinking about it, the needle hasn't moved much. Well, we're stepping up to change that. That requires us to entirely rethink the experience of care, because the care part we're already pretty good at. Now we need to get better at the experience part. And to do that, we must look at the experience of care from the patient's view, always. There are a few things that I want to share with you today about human care. Human care is inspiring. It's about reinventing the care experience. It's about planning for all and delivering to the individual and their loved ones. So it's person-centered care. Human care means humanizing every single aspect of the patient experience so that at the end of the day, patients feel comforted when they are at their most vulnerable, connected to the health providers who care for them, and confident in the care they're receiving, no matter who they are or where they come from. We have 4 strategies for us to get there. First, we will deliver the best care experience when, where, and how patients need it. That means one-stop care wherever possible, so no more moving from appointment to appointment. It means virtual and remote care in ways you've never imagined. Think robotic brain surgery performed by world-class experts right here at St. Michael's Hospital on a patient in Sudbury. It means designing state-of-the-art spaces that comfort and heal, because physical environments matter when it comes to how people feel physically and emotionally. And it means looking at every aspect of care, and I mean every aspect, through the lens of health equity. Second, we will focus on research that prevents disease and customizes medicine. That means not just treating illnesses, but preventing them. It means piloting new devices, testing treatments, and influencing healthcare practices and policies focused on the care experience. And it means customizing care to meet the needs of each individual patient. Third, there will be education that turns learning on its head. That means reimagining how we educate medical learners at every stage of training. It means flipping the script and recruiting some of the best teachers we can think of, patients themselves, so we can learn about illnesses from the very people experiencing them. Research has shown that this kind of medical education creates more empathetic health providers and better health outcomes as well for patients. We even have students living on site at Providence Healthcare, so they can really understand the senior patient experience. A new kind of education also means prioritizing equity and inclusion by focusing on training postdoctoral fellows who are members of Black and Indigenous communities. Fourth, We need digital transformation that makes access to care faster and treatments more precise. That means leading a global digital transformation that will improve access and drive equity and make health systems more efficient, hospitals safer, and treatments more precise. It means designing algorithms that get patients emergency care more quickly, and it means humanizing care by doing the data crunching that will free up healthcare providers to connect more often and more deeply with their patients. Right now, we're working on an artificial intelligence program that can rip through years of patient notes in 6 seconds. 6 seconds. So that doctors make more precise treatment decisions. It means software that can tell us with 99% accuracy whether a patient is at risk of deteriorating and needing to be rushed to the intensive care unit in the next 24 hours. So we can prevent it from happening. This is life-saving stuff, and it's happening right here, right now. We know it's not enough to talk about reinvesting in the patient experience. We need to live it. So we're building the world's first Care Experience Institute, a concrete representation of human care that has 11 different centers, all aimed at challenging old ways of thinking through research and solutions that can be scaled for global use. Think about a center for anti-racism and health equity, a center for food as medicine, a center for patient experience measurement, a center for aging well, where healthcare experts work with patients and their loved ones to create new models of care that make the healthcare experience what it should be. That's human care. Human care is what patients want to receive and what healthcare providers want to deliver. Today is a good day. Today is about what can be. It's about sowing the seeds of hope. It's about action. It's about fundamentally changing practice, first here, and then across Canada, and then around the world. Have a look at this.
Spending hours in waiting rooms, taking 5 buses to get to 3 appointments, living too far from the care you need. Canadian patients deserve better. So St. Michael's Hospital is reinventing the patient experience. We're on a mission to humanize every aspect of the healthcare experience, and we will stop at nothing until we achieve it.
At St. Michael's, over 1,000 researchers, scientists, and staff are working tirelessly, dreaming up new ways to prevent and treat illness. Across the board, everything we're doing to improve our patient experience.
Usually the brain and heart are treated separately, which makes no sense. The two are really actually very linked together. Both disciplines can learn from one another.
The core values of the Brain and Heart Center are to provide outstanding expert patient care, but also do so in an environment where we focus on innovation.
We capitalize on the relationship between the cardiac practitioners and the neurological practitioners and learn from one another.
Providence isn't a place of illness, but a place of wellness, a campus of care where residents and patients from the community can live independent and fulfilling lives with access to the best health services all in one place.
We've made it our #1 goal to make our patients as comfortable, connected, and confident as possible.
Our trauma care is already world-class, but we're taking it one step further by integrating care into one space, so patients won't have to worry about getting around, only about getting better.
There are a number of reasons that the Barlow MS Center is unique. First of all, we are one of the largest MS centers in the world. We're offering people with MS one-stop care in a space that heals and comforts, so they don't always have to move around the city to get from appointment to appointment. We're really trying to integrate clinical care together with science in the field.
St. Michael's Critical Care Unit is home to the world's top 2 ventilation scientists and experts. Their techniques saved lives globally during the pandemic, and now they're creating ventilators that are customized for each patient. And this is what makes St. Mike's special. This is what leads to a much better patient experience and a really true response to what is happening with each individual patient.
Through artificial intelligence, we're able to have predictive algorithms that are able to tell us well in advance, days, weeks in advance, what to expect, how much volume we're going to get, how many patients are going to come into the emergency department. If we had a better idea of what to expect, we'd be able to organize ourselves a bit more effectively and efficiently and be able to provide better care. We can predict which patients are at the highest risk of death, allowing us to intervene earlier with better solutions to prevent the worst case scenario. We've also developed Muskrat, an algorithm that's capable of sorting through years of patient data within seconds. With faster access to information, our doctors can diagnose more accurately and treat more effectively.
As a homeless outreach counselor, we work with patients who are admitted to the hospital to support the inpatient experience. When they are discharged from the hospital, we make sure that their medical, social, and psychological needs are being met.
The challenge with people who identify as homeless is that they don't have the resources in order to be able to follow up with proper health care post-discharge. So it's not equitable for them to be able to get the same care that you or I would get in the hospital because they don't follow up. And so we help them with that follow-up. It levels the playing field so that they can get the health care that they deserve to have.
We've proven that free essential medicines for all Canadians doesn't just save lives, it also saves billions of dollars each year.
We've also put medical and mental health care in schools in at-risk neighborhoods because not every kid goes to the doctor, but every kid goes to school. We're treating children where they are because every child deserves to be cared for.
We recognize that food is a really important part of health and medicine. Food is part of how we prevent illness from occurring in the first place. Food is also how we treat many illnesses and how we sustain that treatment. And it's really important that the food that we serve at this hospital is sustainable for the environment. For us, it's important to serve delicious food that respects our patients' culture, health conditions, and dietary preferences. But it's also important to serve food that feels like home.
A huge part of the Care Experience Institute is tackling mental illness and addiction at the root. St. Michael's is already a leader in this space, but now we're creating new models of research and treatment.
One of our biggest goals at St. Michael's Hospital is to make healthcare more accessible than ever. Remote robotics is allowing us to do exactly that. Soon, people in remote areas who have limited access to world-class care will be able to receive brain surgery from top specialists thanks to this life-saving technology.
What I love about learning here is the emphasis on connecting with patients and their loved ones. St. Mike's has totally flipped the script, and I actually learn about illnesses from the people experiencing them. It really offers perspective and ultimately leads to better outcomes.
St. Michael's Hospital is building the world's first Care Experience Institute. We've already begun, but we still have a long way to go. So we're launching a campaign to raise $1 billion to get there. This is more than healthcare. This is something new, something bigger. This is HUMANCARE. And with your help, we will stop at nothing.
You've just seen what St. Michael's and Providence are already doing when it comes to reinventing the patient experience. As importantly, we have ambassadors who believe in our mission and who have signed on to champion it. Their ideas and their insights have been integral to how this $1 billion movement, yes, I said $1 billion, is unfolding. We are so lucky to have some of the most influential, relentless leaders rally behind this campaign. One of those co-chairs is our HUMANCARE co-chair, Jillian Riley, President and CEO of Tangerine. Welcome, Jillian.
Thanks very much, Lily, and good morning to everyone. I'm honored to serve as a co-chair along with the rest of our exceptional HUMANCARE campaign team. This is a tremendously important undertaking. And what I've seen over the past several years, particularly in the face of this pandemic, is just how central to our life healthcare is. and how meaningful the investments we make in healthcare are. In fact, as we've witnessed over the past 18 months, they've never been more urgent. COVID-19 has been a wake-up call. We've seen it with our own eyes, within our own circles of family and friends, how important it is for people to feel safe and connected at a time when they are at their most vulnerable. And how important it is to have care that meets people where they are, physically and emotionally. Canadians today want and deserve to not simply get better, but to feel better. And what attracted me to HUMANCARE was the possibility that with this campaign, we can get it right for so many Canadians. We can become the architect of a new model that's emulated beyond these walls and actually beyond our borders. And to think what we can do it by tapping into the power of technology as an example, riding the very same digital revolution that is reimagining many industries and many other places. In my world, data and analytics have made banking easier and more efficient and more inclusive than ever before. The world of healthcare can save and change lives, and it can turn the care experience into one that makes patients feel more comforted, more connected, and more empowered, just when they were at their most vulnerable. That is the promise of HUMANCARE, and that's why I'm here today. HUMANCARE is a whole new way of thinking, creating, and managing. Whatever it is that you do, when you find yourself on the receiving end of healthcare, you want to feel confident, cared for, and cared about as a person. We hope you join us in making this happen.
Thank you, Jillian. Now I'd like to introduce you all to Terry Alley. Terry is an outreach worker at St. Michael's Slate Family Emergency Department. He is also the personification of HUMANCARE, and I think you'll see why. Terry, please join us.
Hello, everyone. I'm really happy for this opportunity to speak here today, not because I love public speaking, but because HUMANCARE is that important to me. I waited a long time to be part of something like this. I want to tell you a story that explains why HUMANCARE matters so much to me. First, the story is about a man named Bill. Bill's a real person, and Bill's given me his permission to talk about his story. See, Bill's been wrestling with substance use disorder for about decades now. If Bill goes more than a few hours without drinking, he's going to go in severe withdrawal. He struggles to function. He struggles to pay his rent. He struggles to just maintain his housing. In the past year, Bill's lost his father. He's lost his relationships, and because he couldn't care for him, Bill had to give up his dog. He tried desperately to turn things around, but recovery wasn't easy. Your thoughts are often elsewhere. You're confronted with grief and severe cravings. You often forget about the detox programs that you're enrolled in, and you forget to take your medications. At the end of it, you end up in emergency departments not knowing why you're there or how you arrived there. And at more than one point, Bill thought about ending his life. But here's the thing, Bill's doing better today. You see, my job as a St. Michael's outreach worker is to give Bill and patients like him the very best chance at recovery by providing what they need to move forward, by removing barriers, by sticking with them as they navigate, a pretty tough system, by showing them that they deserve to be loved, to be listened to. Bill now attends a drop-in group. He's seeing a psychiatrist, and he's on a monitored medication regime. We help connect him to the essentials he needs like food, clothing, financial assistance. I think Bill's on the right path. I work with a lot of people like Bill. I know a great many of them. And of course, there's thousands of Bills across the country. As a matter of fact, I see one of them every morning in the mirror. I'm the second story. I'm a Bill. The only difference is the Bill that I'm referring to is that I'm a little further down the healthcare road than he is. My story, addiction, trouble, hopelessness, and then a bit of luck. I got the opportunity to live and work at a drug treatment center. Then I was able to rent community housing. I still live there up to today. I got support stabilizing my mental health. I got support managing my substance use. I'm now an internationally certified addiction counselor. I've been helping people like me, people like Bill, for about 28 years. And every day that I do that, I help myself. Will Bill make it? I don't know. He has a hard road ahead of him, but he's got a chance. He really does. And if Bill makes it, if I make it, it'll be because people saw us. They treated us like people with unique vulnerabilities, unique needs, real human potential. People saw us, they heard us, they got us. I want that for people like Bill and me. I want that for everyone. I want that for the person dealing with addiction and mental health. I want that for the senior who needs help caring for themselves. I want that for the worried cancer patient and the new Canadian who doesn't understand the system and just wants someone to help. I know we have all experienced what I would like to call the impersonal, mystifying, inaccessible side of healthcare, where the experience wasn't what it should have been, where we couldn't get the care we needed, when we needed it, how we needed it, all in one spot, in a reasonable time frame, and especially from someone who knew our stories. HumanCare is going to change that. It's going to change how we experience healthcare. Standing here today, I can tell you I'm excited, nervous, but excited. I believe this is what we need, and I believe it will succeed. This is a watershed moment in healthcare, and I'm so proud to be part of it. I'd like to ask anybody who hears me now to take and help. Help if you can. Thank you.
Now, that's HumanCare. Terry, you are HumanCare. Thank you, Terry. We are so proud to have you on our team. I'd like to turn it over now to our newly appointed Chair of St. Michael's Foundation Board, Pat Manili, for the final word. Pat?
Thank you, Lily, and thank all of you for joining us here today in person and online. It's a wonderful day and a wonderful message. I'd like to close with 3 key points. First of all, we're very fortunate to have such a wonderful team of healthcare leaders associated with St. Mike's and Unity. Dr. Tim Rutledge, our fearless CEO and the visionary behind HumanCare, Najma, who we heard from today, and all the wonderful docs that appeared on the video. But it really is a world-class team, and we're fortunate to have these people delivering the care that they deliver. The HumanCare campaign is all about investing in this team, giving them the tools and resources they need to deliver patient care, not just the normal way, but the true patient-centric human care way. Investing in the digital technology, the platform that they need to make healthcare more efficient and effective. Investing in research funding to support our thought leaders, and investing in education so that St. Mike's continues to be the destination of choice for top talent in the healthcare field. And third, the payoff from these investments will have a profound impact on the patient care experience here in Toronto, but also across Canada, around the world. Anwa and Terry, thank you so much for joining us today and sharing those very emotional stories of your own experience. This really shows how profound the impact will be for the communities that we serve. So there's no doubt that HUMANCARE will transform the patient care experience. There's also no doubt that we have a pretty big job ahead of us because $1 billion's a decent-sized number. Even as a reformed banker, I can say that. It's something that we can definitely do with your support and the efforts of the amazing docs and the foundation team. And let me just say a brief word about the foundation team. Lily and Robin and everyone who's here today, they work so hard. COVID hasn't been easy for anyone, but certainly the team has worked hard. They've had their heads down, and they've delivered through challenging circumstances. And we're so excited now to be back here in person and together and launching this wonderful campaign on this sunny and beautiful fall day. So thank you for supporting this campaign. Thank you for sharing the HUMANCARE story with your network of contacts. And thank you for investing in our vision and our strategy for HUMANCARE.
Spending hours in waiting rooms, taking 5 buses to get to 3 appointments.
Madeline asked me for one more reminder for those in person. There's literally no reason to rush off because we can mingle and mix here. There's a couple stations, interactive stations. So for those online, thank you for joining us. For those in person, please do stay and mix and mingle and talk about the excitement that we have ahead of us. Thank you all.
Spending hours in waiting rooms, taking 5 buses to get to 3 appointments, living too far from the care you need. Canadian patients deserve better. So St. Michael's Hospital is reinventing the patient experience to make healthcare more human. And with your help, we will stop at nothing. This is HUMANCARE.